Older men, what if one 60-second habit could help restore the potency you thought was slipping away? I'm Dr. Julia Morgan, a board-certified urologist. For decades, I've worked with men who assume the only answer is pills, injections, or simply getting old. What I want to show you today is different. It's simple, it's safe, and it takes 1 minute a day. First, let me be clear about what I mean by boost potency. I'm talking about improving aspects of pelvic health that matter to men as they age. Better blood flow to the pelvic region, improved sensitivity, more reliable erectile response for some men, and better bladder control for others. Nothing I say today promises a cure for everyone. What I do promise is a grounded, low-risk approach you can try daily, along with realistic expectations about what it may do and how long it may take. Many men blame age or hormones first. That's common, and sometimes hormones matter. But often the real problem is mechanical: tight pelvic muscles, poor circulation, and nerves that have been quietly compressed by years of sitting, stress, and tension. Think of the pelvic circulation like a garden hose that's been kinked under a heavy rock. The water, in this case blood and nerve signals, can't flow as well until the kink is eased. Gently working the short, coin-sized area between the scrotum and the anus can help relieve that localized tension and encourage better local blood flow and nerve responsiveness. Some people call that spot the perineum, a lay label often used for the perineal area. Medically, we call it the perineum, the small area between the scrotum and the anus. That's the spot we'll focus on today. Here's the quick promise aligned to the title you clicked. Older men. If you do this simple, gentle technique for 60 seconds every day, it can help improve circulation to the pelvic floor. That can translate into small but meaningful benefits, sometimes noticed in days, more consistent changes around a few weeks. It's not a miracle, it's a retraining and restoration strategy. If you think men deserve real, practical solutions, hit like and tell me where you're watching from in the comments. Stay with me, I'll walk you through the why, the how, and the safety steps. Let's cover the basic physiology in plain terms so the technique makes sense. The pelvic floor is a group of muscles and connective tissues that sit like a hammock under your pelvic organs. Those muscles support the bladder and prostate and help regulate blood flow and nerve signals. Over years of sitting, poor posture, chronic stress, or even previous injuries, those muscles can tighten. Tight muscles press on small blood vessels and nerves in that area. When vessels are compressed, the local blood supply shrinks. When nerves are irritated, signals that should get through become muted. Together, that's a recipe for weaker sensitivity and less reliable erectile response, and sometimes urinary changes. Why would a minute of gentle stimulation help? When we use soft, controlled pressure on the perineal area, several things may happen. The pressure and gentle movement can encourage tension to release in the nearby muscle fibers. That loosening can ease compression on vessels and nerves. Increased movement and warmth in that area can promote local circulation. In lab and clinical settings, simple mechanical stimuli can increase the local factors that encourage vessel dilation. Think of molecules like nitric oxide that help blood vessels relax. I'll be careful with language. We say these actions may help improve circulation and nerve responsiveness. Many men notice a change. Not all men will, and the degree of change varies with individual health, vascular disease, medications, and other factors. Now the practical part. You can do this at home. It's private, it's non-invasive, it's gentle. Find a comfortable position where you can relax your hips and core. 2 positions work especially well for most men. One option is to sit on the edge of a firm chair with feet flat on the floor, knees about hip-width apart and your pants loose. The other option is to lie on your back with knees bent and feet flat on the bed or floor. Choose whatever feels private and comfortable for you. Start by warming your hands. You may use a small dab of a natural oil if that makes the motion more comfortable. Good, gentle options include castor oil, fractionated coconut oil, or black seed oil. These can reduce friction and feel soothing. If you try an oil, test a drop on the inside of your forearm first and wait a few minutes to make sure you don't react. Use a small amount and warm it in your palms before applying. If you have sensitive skin, scarring, or a history of dermatitis, skip oils or ask your doctor first. To locate the spot, place a clean hand on your pelvic area and feel the small patch of skin between the scrotum and the anus. Again, medically, the perineum. The area is roughly coin-sized. Some men find a slight tenderness there. That can be a normal signal that the tissue is tight. If it's extremely painful, stop and consult a clinician. Do not press through severe pain. Use your index and middle fingers for the technique.
Keep your pressure gentle, the firmness you would use to press a ripe tomato. That's a helpful comparison most men understand. You don't need to push hard. The goal is to create a soft, steady pressure and subtle movement that tells the local muscles and nerves it's safe to relax. You can choose one of 2 timing patterns for 60 seconds total. One method is circular massage. Make slow, deliberate circles with your fingers, moving clockwise for 30 seconds and then counterclockwise for 30 seconds. Keep your breathing slow and even as you do this. Another method is pulsatile pressure. Press gently for 5 seconds, then release for 5 seconds. Repeat that on-off cycle 6 times.
Both approaches accomplish the same end: brief, repeated mechanical signaling to the area. If you prefer, you can combine the two: 3 cycles of 5-second presses, followed by a 30-second easy circle. Whatever you pick, total time is 60 seconds. A few practical cues will help you do this safely. Keep your abdomen relaxed and don't hold your breath. If you feel pain, sharp sensations, bleeding, or new numbness, stop immediately and contact your healthcare provider. Avoid any technique that feels like sexual stimulation for pleasure. The aim is therapeutic restoration of circulation and muscle tone. Do this as self-care, not as stimulation for another person. If you have a history of pelvic surgery, unexplained lumps, or active infections, check with your urologist before trying this. Timing through the day can make a difference. Many men find morning or evening works best. Pick a consistent time and stick with it. Doing this after a short walk or gentle warm-up can enhance comfort because the entire pelvis will already have slightly improved circulation. Consistency matters more than intensity. 60 seconds every day trumps a single forceful session once a week. Complementary habits magnify results. A short, brisk walk for 10 minutes, particularly after meals, helps shift blood to the pelvis and legs and reduces pooling in the abdomen. Simple breathing exercises reduce sympathetic nervous system activation. In plain terms, they reduce stress and help your muscles relax. After the 60-second massage, try 5 deep breathing cycles using a 4-2-6 pattern. Inhale for 4 counts, hold gently for 2 counts, exhale slowly for 6 counts. Repeat that 5 times. This combination of gentle manual work followed by calming breath work can amplify the relaxation response and promote better local blood flow. Let me give you a few patient examples so you know what realistic timelines look like. Robert is 64. He told me he tried pills in the past and felt discouraged. He started the 60-second perineal technique and did a 10-minute walk after dinner. Within a week, he noticed morning erections were firmer than before and that his pelvic discomfort had decreased. By 3 weeks, his reports were clearer, more consistent responses and less anxiety around sexual activity. James is 70. He expected slow results and took a cautious approach. He performed the technique nightly while doing 5 breaths after each session, and also cut long periods of sitting into shorter stretches with short walks. James noticed small improvements in sensitivity in about 10 days, and more reliable response after 4 weeks. Daniel, 65, had prostate-related urinary urgency in addition to erectile concerns. He combined the 60-second technique with pelvic floor stretching and walking. Over several weeks, he reported fewer sudden urges to urinate during the day and improved confidence. These are examples, not guarantees. Each man's baseline health, medications, and vascular status affect outcomes. Some men notice changes fast, others take longer or notice subtler shifts. You may wonder why pills sometimes work faster, but the technique can be more sustainable. Oral medications can temporarily increase blood flow through systemic pathways. They often help men in the moment. What they don't do is retrain a tight pelvic floor or directly reduce local muscle tension. The 60-second daily habit is intended to change mechanics over time, to teach the local tissues and nerves to operate with less compression. Think of medication as a helpful tool for an immediate need, and manual, consistent practice as a way to restore function over weeks. Let's cover the oils in a bit more detail, since men ask about them. Castor oil has a long history as a topical for warming and soothing tissues. Fractionated coconut oil is lightweight, unlikely to clog pores, and often well tolerated. Black seed oil is traditionally used in some cultures for tissue comfort and has antioxidant properties in lab studies. Use any oil sparingly. Do a patch test on your inner forearm first. If you have a history of eczema or very sensitive skin, skip oils or speak with your clinician. Don't use perfumed or heavily fragranced oils on that delicate tissue. Avoid heating oils in the microwave. Simply rub a tiny amount between your palms to warm before applying. A word on common mistakes. One is applying too much pressure.
You shouldn't be bruising or seeing changes in skin color. 2 is performing the technique aggressively or for long stretches. 60 seconds is the target. 3 is inconsistency. Doing it once and expecting a miracle won't help. Make it daily for at least 3 weeks, and you'll be able to assess whether it's providing benefit. Another common error is combining this with other invasive or aggressive pelvic therapies at home. If you're also working with a pelvic floor physical therapist, coordinate with them. If not, start gently and consult if anything is unclear. How will you track progress? Keep a simple log. Each day, note your 1-minute session, your breathing practice, whether you did a walk, and then any subjective changes: morning firmness, ease of penetration, less urgency, improved confidence. Rate each day on a simple scale of 0 to 5 for overall pelvic comfort. After 1 week, review trends. After 3 weeks, decide whether to continue, adjust, or speak with your provider. There are medical red flags to watch for. If you experience sudden severe pain, new bleeding, new numbness in the perineal region, or sudden changes in urinary function like inability to urinate, stop the technique and seek urgent medical attention. If you have active infections, open wounds, or recent pelvic surgery, check with your surgeon or urologist first. Do not use this technique in place of treatments your doctor has recommended for serious conditions.
In particular, if you're on anticoagulant medications or have bleeding disorders, consult your prescribing clinician before applying topical oils or manual pressure. Do not stop or change prescribed medications without speaking to your provider. Let me address some likely questions. Will this increase testosterone? We don't have evidence that a minute of perineal massage daily will raise systemic testosterone in a meaningful or lasting way. That's not the goal. The aim is localized improvement in circulation and muscle tone that can support better pelvic function. Can you do this with a partner helping? For privacy, safety, and practical reasons, I recommend you perform this yourself. It's a personal self-care practice. If you do choose to involve a partner, discuss boundaries, consent, and comfort openly, and avoid anything that feels like sexual stimulation rather than therapeutic touch. What about men who have erectile dysfunction because of diabetes, vascular disease, or nerve injury? Those systemic conditions affect outcomes. This technique may still offer benefits by reducing local tension and improving comfort, but it's not a replacement for comprehensive medical care. If you have diabetes, peripheral vascular disease, or a history of pelvic surgery or radiation, talk to your healthcare team about whether this is right for you and how to integrate it into your overall plan. You might also be wondering about frequency beyond daily minutes. Some men do the 60-second routine twice a day and report added benefit. Others stick to once daily and see good results. Begin with once daily for 3 weeks and track your response. If you feel better and want to try twice daily, discuss that with your clinician, especially if you have underlying conditions. Let me bring this back to the people I see. The common thread with men who benefit most is consistency, modest lifestyle changes, and patience. They stop sitting for hours without moving. They add short walks. They do the 1-minute perineal routine each day. They practice calming breath work. They create a small habit and keep it. That kind of steady, mechanical retraining is how tissues remember better patterns. Many report less anxiety about performance, and that alone improves outcomes. I'm going to ask you to try a focused commitment. Try this daily for 3 weeks. If you decide to accept that challenge, type "ready" in the comments below so we can track how many men are willing to give it a real shot. Commit to the minute for 21 days and notice how your body responds. If something changes for the worse, stop and seek medical advice. If you're on medications, especially nitrates or anticoagulants, or have significant cardiovascular disease, check with your prescribing clinician before starting new physical routines. Don't stop medications on your own. Before I finish, I have to say the mandatory part. This video is for educational purposes only and does not replace personalized medical advice. If you experience pain, bleeding, sudden numbness, or significant changes in urinary or sexual function, consult your healthcare provider promptly. If you have a complex medical history, recent pelvic surgery, or are unsure whether this is safe for you, please speak with your doctor. I'll state that aloud now, and a written caption will appear on screen for clarity. Educational only, consult your provider for pain or concerning changes. A few final practical tips. Make a reminder on your phone labeled 60 seconds at a consistent time each day. Pair the minute with another habit you already have, like brushing your teeth in the morning or a short pre-bed routine. Keep the motion gentle. If you use oil, limit to a pea-sized amount. Combine the massage with your 4-2-6 breathing sequence each session for 5 breaths. Add a 10-minute walk after a meal when you can. Track progress in a simple notebook.
celebrate small wins, and remember that patience and routine are your allies. This approach is not a replacement for medical care, but for many men, a focused daily minute of gentle self-care can help unkink that hose, ease pelvic muscle tension, and improve circulation. Small steps that support potency-related function over time. I've seen men regain confidence, reduce urgency, and feel more connected to their bodies simply by committing to this short practice and a few supportive lifestyle habits. If you found this helpful, subscribe for more practical, science-minded strategies for men's pelvic health. And again, comment ready if you'll take the 3-week challenge. Thank you for trusting me with your time. Be gentle with yourself, be consistent, and check in with your clinician if anything changes.